Hi, Ajit.
Yes, Roman. Yeah.
Um, there are many complications after this disease, and one of the famous or most frequent is complications related to inspiratory tract. So, a cough after this disease, and nose blocked after this disease, and throat issues after this disease should be discussed. Uh, Please let us start.
Yeah. The first rubric which always I take for post acute episode, anyone, especially maybe Omicron or maybe COVID or maybe simple influenza. I always find a host of remedies, and this rubric contains first ammonium carbonicum. Then you will find Rumex sanguinaria, Sticta pulmonaris, and strychnine. These are some of the remedies which are more indicated. We can just begin with ammonium carbonicum. Ammonium carbonicum has right from you see very simple congestion to very life-threatening respiratory failure. So its range is a very important range to study. It's like arsenic album. It is not like euphrasia or allium cepa, where there are some symptoms like sneezing and then mild, you will find the nasal discharge and maybe a cough mild in allium cepa. But it doesn't cover the collapse, it doesn't cover the failure of the lungs, pneumonia, which is very strong. Ammonium carb comes as a remedy, as a rescue remedy, some remedy which rescue the physician and the patient from the tormenting situation. So you will have ammonium carb. What is important is the attack of cough is worse by dust. So patient ammonium carb is allergic to dust. This is very important because post Omicron cough, which is because of the tracheitis, is worse by dust. Associated with this, you will always find snuffles of the nose. So the nose feels blocked, the nose feels stuffy, and patient has obstruction, and he has to keep his mouth open. And then there is a constant complaint that there is a shortness of breath because of the nose obstruction. Then in ammonium cough, the whole issue is the cough is dry, worse at night, especially 3 a.m. aggravation, like Kali carbonicum. Then this cough is, you see, associated with hypostatic congestion of the lungs. Hypostatic congestion means there is a congestion and nothing moves. It's a kind of a patient has no capacity to cough out the expectoration, so it is accumulated. There is a kind of a COPD, what we call as atelectasis. There is a failure, the lungs do not move. So naturally, you will find that the patient has complication like pneumonia, for example, and then you have uh, some hemorrhagic hemoptysis or epistaxis that comes through because of some amount of microthrombi, which are also produced in COVID-19, for example. So ammonium carb is a very important remedy. It's a deep acting remedy. Uh, in ammonium carb, how will you recognize ammonium carb? This is you will find increasing difficulty in breathing. I will repeat it again. Increasing difficulty in breathing. In other words, the oxygen saturation is decreasing progressively. It was 96 4 days back. Now it is 94. Today it is 90. Now recently it is now 86. So this progressive diminution of the oxygen saturation is a very good indication of ammonium carb, which can be competed only with a remedy like antimonium tartoricum and carbovegetabilis. Now, you will find that this remedy ammonium carb is also for fungal infections. So mucormycosis, which was a complication of Delta variant more, with what we are discussing today is a very good combination for ammonium carbonicum. Then what is the difference between ammon carb and carbovegetabilis? Carbovegetabilis longs for air. There is a air hunger. So in spite that there is a coldness outside, he wants the fan to be continued. Then both ammonium carb and carbovegetabilis have coldness of extremities, but the difference is you see more toxicity, and as if the patient's all expressions are very serious and severe, is more encountered in carbovegetabilis. It is as if the death is apparent. Arrested respiration, death apparent is a rubric where you will find both the remedies. But carbovegetabilis is much more important here, along with arsenic album. So these are the issues between these two remedies. Antimonium tartaricum has white tongue. This is a main differentiation between ammon carb, carbovegetabilis, and antimonium tartaricum. Antim tart is also a remedy of collapse with coldness of the extremities. Yeah. So these are the some of the observations. And if you read Borderlands pneumonia, you will find a lot of clinical observations of this very astute homeopath. Yeah, yeah. So we can discuss a host of remedies here. And
Yeah, let us
yeah,
go for the more cough section,
yeah,
cough and differential diagnosis of cough
yeah,
in
yeah,
this
yeah.
post this.
Okay. Now, if we are understanding cough, there is a very interesting remedy which has got spasmodic type of cough, that is bromium. Bromium comes from the halogen, so naturally it is deeper acting. With bromium, you will find that there is a croupy cough. So you have a barking type of cough, what you see in Drosera or in Spongia. And this is a suffocative cough. So the patient says that the cough spasm is with shortness of the breath, which is very important symptom of bromium. And then there could be rattling of the mucus in the larynx. So it may be a dry cough, or it may be associated with some congestion and mucus, which is accumulated in the lungs. So there is a rattling. And more than that, you will find that if there is an inspiration, then cough is induced. So when the person takes a deep breath, there is a bout of the cough. Two modalities are extremely important, and otherwise also in cough symptoms, looking up. If the patient is looking up and there is a cough bout, you can take the rubric head bending backwards, aggravation of the cough. So you will find here bromium also indicated. So
Sorry, Ajit, just to
yeah,
recollect
yeah,
this, to remind this,
yeah, yeah.
one of the films in Oscar competition is Don't Look Up. Now I understand that they took a lot of bromium.
Yeah.
So looking up, it's bromium, looking up aggravation.
Yeah.
Sorry to interrupt you. And I wanted to ask if we are talking about bromium, can you say a few words about bromium and spongia in this aspect?
Yeah. First thing is that looking backward is also covered by spongia. In addition to very simple Bryony and Rumex, but you will find that spasmodic cough is different from bromium in the sense that lying down aggravation is a very strong symptom of spongia than of bromium. The second thing, with a spongia, you will find the child wakes up with the bouts of the cough with a lot of suffocation. And then he has a feeling that next I will not be able to breathe. Such a you see breathing intense shortness of the breath is experienced by spongia. This is the reason why spongia is a very useful remedy for cardiac cough when there is a congestive cardiac failure and that induces the cardiac cough with orthopnea, and the person wakes up with the bout of the cough with a feeling that next breath will be impossible. So this is spongia. Uh, with spongia, you will always find a cough after waking up more. Due to the spasm of the cough, the patient wakes up. In Drosera, the cough may be continued even during sleep, and patient may not wake up at all. So these are some small observations between these two remedies. Yeah,
Great.
yeah. If you take now a very important remedy, not collapsing condition, nothing like a very big pneumonia, just cough doesn't go away, and it could be carbo vegetabilis. Now, how will you recognize this? Usually, cough is associated with hoarseness. So there is a rubric, hoarse cough, which contains a lot of remedies. Carbo-veg hoarseness is such that patient cannot talk because there is such a big weakness of the vocal cords. So patient cannot even speak. The second thing with carbo-veg, you will find that you will get the history. I had Omicron, I had cough and everything, a fever. And now this post-influenzal cough with weakness. So usually you will find that nothing moves. There is a lack of reaction. There is a weakness which is prominent from day first to the day of consultation in your practice. So this is carbo-veg. And what is important is this hoarseness is worse by talking. Hoarseness is long-lasting. Hoarseness is worse in the evening because you have talked a lot and exhausted yourself. And the vocal cord now is not in a position to again have the vitality to go for the voice. Then there is a itching sensation more in carbo-veg. Tickling sensation is more in spongia. Tickling sensation also Nux vomica and Hepar But in carbo-veg, you get itching sensation. And there is a gagging and vomiting, which is very important. So the person has a spasmodic cough, and there is a gagging, like ipecac. So it is very important that this is a remedy which induces a gastric reflex also. So you will find this gastropulmonary reflex and this axis between gastric and the lungs. This is created by carbo-vegetabilis because it is a carbon. So everything is related to the abdomen. So if you find cough with burping, cough ending in sneezing agaricus. But do you know cough ending in eructations? It is carbon group in general, especially carbo vegetabilis. Even in a history, you are taking a patient and patient is burping during the interview. And he's burp 15, 20 times. Remember, it could be a carbon remedy. Do not be prejudiced, but it may be a carbon remedy.
Just remember.
These are some of the observations. Yeah. So you will find that a patient has aggravation in the evening more. So vomiting of the mucus and what is important, itching in the larynx and burning in the chest. This is a combination.
Itching
Because carbon,
larynx and burning in the chest.
yes, yes, because all carbons have the burning. Because they have a lot to do with oxidation and combustion. No? Defective oxidation, defective combustion. So everything is you see continued, and then you will find nothing is moving. So I mean the influenza and the illness being continued, fever gone, cough continued. This is characteristic of the carbon group. You know, creosote is also a very important remedy for post-influenzal cough. And what kind of the expectoration you are able to see in Carbo vegetabilis? It is yellow-green, greenish, thick, sticky, and maybe purely yellow, like phosphorus, or like natrum phosphoricum. So you will find that this is very interesting aspect of the expectoration of carbohydrates. So my comments is that this is a remedy where delayed convalescence is there. Recuperation is slow. And patient has become so weak that he has no power to talk, no power to even cough. And there is a air hunger. This combination will make you to go for carbohydrate. Yeah. Now,
And just,
under
sorry to interrupt. Just to comment by short rubric, you know, this rubric cough after influenza or cough after flu. And strangely, it's only two remedies are there: ammonium carbonicum and sanguinaria.
yeah.
And I'm sure that you can add to this rubric kind
Yeah.
of.
In the complete repertory, this is a very good rubric being prepared, and Tarkas added many other remedies. You know, sanguinaria is also a remedy for fainting, unconsciousness with coughing.
Sanguinaria.
Yeah. Sanguinaria is a very important remedy, and it is a very deeper acting remedy. I can tell you about, you will find.
So when we
sanguinaria.
discussed the case of breathlessness and fainting, and we talked
Yeah.
about phosphorus, for example, so we can add the sanguinaria
Yes,
for.
we can add sanguinaria, and you know, sanguinaria is like carbohydrate associated with gastric complaints. So gastric cough, as if the cough begins from the stomach, and this cough is associated with a lot of gastrointestinal symptoms like irritations, vomiting, and then the cough in sanguinaria is extremely spasmodic, like a whooping cough. So after influenza cough, whooping cough like condition, spasmodic, and constant hacking cough. And there is a constant tickling in the behind the sternum. It is not a tickling in the larynx of spongia and rumex and hipar. It is a tickling in the sternum, which is very important in sanguinaria. Then you will find that in sanguinaria, a person can wake up from the bouts of the cough, like spongia. Then in sanguinaria, patient has to sit up in bed. Unless he sits up in bed and passes the flatus, both upward and you see downward, cough doesn't disappear. Tarkas used to call this as a deflation. Deflation means amelioration by erectations, amelioration by flatulence. Then it reduces the cough, like argentum nitricum. Then this cough, like carbovage, also in sanguinaria, exhausting cough. Exhausting cough is a very important word to understand. You will understand this word better if you know sternum metallicum exhausting cough. Sternum met person coughs, and gets exhausted. And this exactly happens in fibrosis of the lungs, in interstitial fibrosis, in COPD, in carpulmonale emphysematous bronchitis, which is a complication of chronic bronchitis or asthma. So what you are able to see here is the lungs capacity is poor. And on the background of that, there is exhaustion because lung muscles are weak. There is no tonus to the muscles. So huge problems of weakness available with sternum metallicum and also with this wonderful remedy, which is nothing but you will find sanguinaria. It is unfortunate that this remedy is less used by the people. Even if you take original metalomedic of sanguinaria, you will find tuberculosis of the lungs causing fibrosis of the lungs. One of the remedies indicated is sanguinaria can. So fibrosis, it is a remedy. So you can see how much important this is a remedy for post-COVID fibrosis of the lungs. Then there is a very strange modality in pneumonia. Patient wants to lie down in bed. With coughing, he has to sit up in bed. But as long as he is lying, he feels better in pneumonia. So without cough, when he's just lying down, like manganum aceticum, sanguinaria patient feels better. So this is a paradoxical opposite modality of sanguinaria can. With sanguinaria, you will expect also blue nails and coldness of the hands, like ammonium carb, like lachesis, like carbovegetabilis,
Like
like
antimonium plataricum.
yeah, correct. Yeah. So this is a very important remedy, and you know uh, why sanguinaria has a special place, because sometimes the pneumonia becomes a subacute pneumonia. It doesn't go away. It doesn't kill a person, but it doesn't go for the full recovery. So the system comes with pneumonia, which is unresolving type. This is sanguinaria more.
I would like to ask here. I know that you was almost pioneer to bring this idea, at least to Israel. You brought this idea of intercurrent prescribing 20 something years ago. And here, what would be the difference when the system is not going to any place like we discussed carbovegetabilis or in this lung problem sanguinaria, but sometimes you will see that system doesn't go to any place because there is no energy in general, and you will ask maybe it's psorinum or sulfur or some other nosode to
basically you see there is a very big rubric, lack of reaction, which contains more than 100 remedies. This is a very important rubric for all cases who have sustained the acute episodes of all kinds, and the system is with lack of reaction. So we have to first define what is this lack of reaction. So the concept of the lack of reaction is that the system doesn't rally. The system is so weak that it has no power to react to the medicinal stimulus. When we give a medicine, we give a stimulus, like air is a stimulus, your tea is a stimulus. A remedy is also a stimulus, although it has a different perception, different field of operation. So the idea is that in spite of giving stimuli of right character based on the law of similars, it is not working because the system is very weak. Then comes up the role of lack of reaction as a rubric. Let us take first a very simple rubric. lack of reaction, influenza after. So you will find here remedies carbo vegetabilis, China, phosphorus, sorinum, and tuberculinum. Sorinum is a very important remedy. I think I also discussed last time also, but I repeat because this is a gift to the homeopathic people, Sorinum. Sorinum you could use for any kind of the debility, mental as well as physical. And then the system goes into a kind of a slumber. Patient doesn't go into rallying. Patient's mobilization of the resources is not possible. So you have the energy, but you can't use the energy because this energy is made, you see, conceal. And someone is preventing you not to use the energy. Sorinum will allow the body to use the energy. Sorinum is for post-influenzal cough. Sorinum is for anything where chilliness is constantly present, constant chilliness. 8 days back, I had the fever, I had flu, everything is okay now. But this chilliness and weakness, I am suffering still. I need the blanket, I need the sweater, I want to lie down. I have no power to stand up and walk. This is Sorinum state. So I always say that Sorinum is one of the great tonics of homeopathic Mantra Medica. Great mineral and vitamin is Sorinum. You know, on the basis of this, Sorinum is used by many people with cancer chemotherapy weakness, like uranium nitricum, arsenic album, cadmium sulfuricum. You will find Sorinum is also one of the remedies against cancer chemotherapy weakness. Not only that, you can use this remedy for cancer cachexia. So there is a cancer, there is a emaciation, there is a profound debility. So you can use Sorinum against many these conditions also. Take for example, you had a patient of cancer, the patient had surgery, irradiation, chemotherapy. She came out of the breast cancer, for example. Now she had COVID and the cough doesn't disappear. Weakness doesn't disappear. This could be a big entry for Sorinum state. So it is in this way the remedy based on the past, based on the present, based on the basic characters, basic essence, they differ. So you can ask me what is the difference between Sorinum and tuberculinum. Comparatively, tuberculinum is more warm-blooded than Sorinum. Second, this debility of Sorinum doesn't allow Sorinum to move on. Whereas without movement, without wandering here and there, without locomotion, tuberculinum can't stay. It is like more arsenic album or arsenic iodine, or even like sulfur. Tuberculinum patient can sit in bed for a long time, cannot be sitting in one posture for a very long time. So these are the issues of tuberculinum. Sorinum is so debilitated, like muriaticum acidum, he doesn't have the power even to move the hand. So then with Sorinum, you will find patient starts improving. And in such cases, always better if you want to give a medical stimulus of Sorinum, better to give 30 potency 3 times for few days. Then there is a very good response, early good response. Yeah.
33 times for
3 times for 3 days, 5 days, 1 week. Then there is a good improvement. Patient regains some energy.
okay. And then now a few words, we coming back to cough. Maybe if you want to add something, I just want to tell that you said several times that very good post-influence remedy, especially post-influence cough remedy, creosotum. And we have ammonium carbonicum sanguinaria, creosotum, and even psorinum you mentioned now. So
yeah.
For cough after this like flu states,
Yeah. Yeah.
What would be suggested more?
I will tell you. Crevosotum cough is more with Crevosotum cough is more tormenting, and with bouts of the cough, there is more weakness. And like Carbovegetabilis, even crevosote has no power to cough. Maybe uh, patient has hoarseness of the voice and doesn't want to talk also. Discharges of expectoration in creosote are blackish, like sickle core. Even with all other carbons also, you will find black discharges, because blackness is also a characteristic of carbon remedies. All carbons look after burn black also, no? So you will find carboanimal is one of the remedies, like China and arsenicum album for blackishness. Many people have black, you see here. So there is a discoloration blackish, maybe due to melanin precipitation. People have tendency. So here you must look at creosote from that angle. Expectoration black. Even the menstrual flow is black also in creosote. Yeah. Yeah.
And strychninum, you mentioned in the beginning strychninum, Ajit.
What, Roman?
You mentioned in the beginning strychninum.
Yeah. Yeah, this is a very important remedy. If you take you see strychnine, you will find that uh, all strychnines are characterized by weakness. You take plain strychnine, you take strychnine arsenicum, you take strychnine phosphoricum, strychnine sulfuricum. So the theme with strychnine is weakness. Now this weakness in strychnine is of the organs also, and also of the muscles. So there is a muscle atrophy, there is a muscle emaciation also, what you see in sometimes neurological conditions like amyotrophic lateral sclerosis, or in hypertrophic muscular dystrophy, muscular paralysis, multiple sclerosis. So all these muscle lameness, paralysis, weakness, these are all the issues about the strychnine. It is unfortunate that strychnine group is not very much used in homeopathy by the people. Take for example, strychnine is a element which is also a neurotransmitter which is present in Ignatia also. So we have to understand this whole theme of strychnine based on strychnine. So according to the idea of how cation anion relationship is present, you can go ahead in selection of the strychnine. Take for example strychnine arsenicum. So arsenic as a very strong one associated with strychninum, it will make a huge change in understanding the remedy. So this is about the idea of usage strychnine. Yeah.
And
I am using, for example, strychnine in one case of hypertrophic muscular dystrophy, in one case of multiple sclerosis. Yeah.
so Ajit, the main differentiation in strychnine cases with weakness, with carbon group. For example, when you will go for carbon group with weakness and debility, and for strychnine, first this neurological aspect with paralysis, and what else?
Yeah. You see that in strychnine, you have spasms of the muscles. So it's like a reflex excitability, maybe of the spinal cord, maybe of the bladder. So it's like you see spasms associated with weakness. So carbon group is less for spasms. Cuprum group is more for the spasms. So this differentiation, if you want to make at a deeper level of the pathogenetic symptoms, you will always find the issue with strychnine is much more of spasms. Let us take, for example, Nux vomica. It is like a strychnine having a lot of spasms. So opisthotonus, for example, is a very good symptom of Nux vomica. And where previously people used Nux vomica for the treatment of tetanus, because at that time the tetanus toxide injections were not available. So Cicuta virosa, then Nux vomica, Hypericum, Ledum, they were used by a lot of homeopaths for the treatment of tetanus toxide. So associated with spasm now, what is important is the reflexes which are being created become very active in strychnine. So active reflexes means it's a kind of a, you see, spasmodic condition of the entire system. So the system becomes agitated.
So from
this
one side, the
agitated
system
system,
agitated, and from another side, there is a weakness.
correct.
Is it
Now,
coming together, or
yes.
after agitation, weakness
No,
appears?
it could be like, but the first is about stimulation. You know, the action of strychnine is to stimulate the motor centers in our body. And then you have the reflex. So agitation comes later on. And because of the agitated state also, there is a weakness. I mean, you cannot put your body agitated for a long time, because then muscles get exhausted, the system gets exhausted. So many times you will find strychnine is with spasm, then weakness. Then you will find sometimes there is a middle stage of relaxation of the muscles. Means the paroxysms are present, the reflexes are overstretched and overpresented. Then there is a pause in between where the system becomes extremely weak and doesn't show any reflexes. It's like you see algentum nitricum state, no, a phase of stimulation followed by a stage of depression. So there is a vagotonia, for example, there is a convulsive state of the economy, for example. So this is what we are going to see as stages. Stage of stimulation, stage of depression, and alternating stages. So you will find the same theme with agaricus also, a fungus. But in agaricus, you will find there is a hypertonicity and then convergence, and then it is a kind of a motor paralysis also. So many of these CNS acting remedies, including even the spiders, they have the same theme of you see spasm, reflexes, paralysis, lameness, muscles do not obey the order, neuromuscular junctions are affected. So you are able to see this theme in a host of remedies.
So I did just last question.
Yeah.
Tell me, please, strychninum in relationship to cough. We said this cough will be spasmodic with weakness.
Yeah. First thing is that it is a very persistent cough associated with weakness, and there are spasms of the muscles of the larynx. It is not only irritation, tense sensation, it is actually a spasm. And then the spasmodic variety of the cough as a big reflex, as a loud reflex, you are able to see in strychnine. And then it is associated with excessive breathlessness. You can compare this excessive breathlessness with, you see, lobelia inflata or with antimonium tartaricum. So this remedy is a very deeper acting remedy, and we need a deep consideration of the strychnine group in general. And this group is, I think, if I'm not wrong, neglected in our Materia Medica. Yeah.
Great. Majid, thank you very much for this short but very deep excursus. I think it will be very important and interesting. Thank you very much. Take care.
Yes, Mama. Yeah. Okay. Bye-bye. Enjoy.